My name is Tanji Carr, and today I'm going to be taking you through the steps of changing a central line dressing. We're going to do a central line dressing change. Um, what I would do first is to prepare all my materials, okay? And then I'm going to perform hand hygiene. Perform hand hygiene, okay? Now, before I would have even entered the room, I would have checked the chart and the orders to make sure this is the patient that we're dealing with, and we're indeed doing a central line dressing change. So now that I've done my hand hygiene, I'm going to go ahead and apply my mask to myself. Then I'm going to go ahead and instruct my patient to turn his head away from the central line so that we're not contaminating. And then I'm also going to apply a mask for my patient, okay? Now that we've done that, I'm going to go ahead and apply my clean gloves. Okay, and so once I've applied my clean gloves, I'm going to go ahead with my non-dominant hand and I'm going to stabilize the catheter, okay? And then I'm going to gently, with my dominant hand, I'm going to gently go ahead and remove the edges, and we're going to be pulling straight out but parallel to the skin. And we're going to do that on all four sides. We're going to do it gently, straight out and parallel to the skin so that we don't dislodge the catheter. And once that's completely removed, we can go ahead and discard the bandage, okay? And then we can also we want to take a look, sorry, my glasses are fogging up. We want to take a look at the catheter, and what we're looking for is signs of infection, redness, bumps, anything that shouldn't be there. And we want to verbalize this to the patient too. So I'm just inspecting the catheter. I'm just trying to make sure that there's no signs of infection and all looks well, okay? So then I can go ahead and I can discard my clean gloves, okay? Now what I'm going to do is I'm going to go ahead and perform hand hygiene again. And now we're going to go ahead and set up our sterile field. Okay, so now to set up the sterile field, we're going to open this away. I'm going to open this away from myself to keep it sterile. So we open it away, and then I just go ahead and I want to kind of like turn this, flip it down a little bit so that it doesn't pop back up. Because sometimes it can pop back up and then it will contaminate. We don't want that. So the first thing that I'm going to do is I'm going to grab my sterile dressing out, grab it just like that. And I can grab on the sides because the sides are okay for me to touch within 2 inches. Now the shiny side, we're going to set that down just like that. And I'm going to make sure that I don't go over the field, but I can kind of move it around just as long as I'm keeping, not going within that 2 inches. So now, second thing I'm going to take out is my sterile gloves, and I'm going to make sure that I don't go over my other sterile field, that I come right to the side so that I can open these up and put them on. Now before I put those on, I'm going to empty the contents of the package into the field, okay? And make sure that I'm not touching and that they don't bounce out and go off of the field, but they're right on the field like that. Then I can discard of that packaging, okay? Now I'm going to go ahead and I'm going to don my sterile gloves, but I'm going to move this over just a bit so that you could see my sterile gloves. Now the sterile gloves, same border as the field, the sterile field. I can touch the outside, I just can't touch the inside. So now that that's open, I hope you can see, I'm going to go ahead and take my non-dominant hand and I'm going to grab the cuff of the glove for my dominant hand, just like this. It's okay for me to touch that. Now I'm going to go ahead and place my dominant hand into the sterile gloves like so, okay? Now using my 2 fingers, I'm going to go into the inside of the cuff for my non-dominant hand and grab sterile to sterile so that I can now put the glove on my non-dominant hand. So going inside, making sure not to touch the exterior, but just remaining sterile to sterile. I'm going to go ahead and put the glove on my non-dominant hand. Now that I'm sterile, both hands, I can go ahead and fix things up. Okay? Now what we're going to do is we're going to go ahead with my dominant hand. I'm going to grab the chlorhexidine, and I'm also going to grab with my non-dominant hand, I'm going to grab gauze so that I can stabilize the catheter during the cleaning process. Okay? So I'm grabbing the chlorhexidine, and then I'm grabbing the gauze. And now I'm going to go ahead and I'm going to hold the catheter with my non-dominant hand, and I'm going to go ahead and clean. Now when I'm cleaning, I'm going back and forth with friction, right? And we're going to do this for 30 seconds, just back and forth until we go around the entire catheter. So we don't want to do it too hard because we don't want to dislodge anything, but also we want to do it with friction, back and forth, all the way around, so that we're cleaning and making sure it's clean. And then we also want to clean the tubing, right? So we're going to take the chlorhexidine, and we're also going to clean the tubing all the way around, back and forth, friction. And we're going to do that for about 30 seconds, okay? Now I'm going to go ahead and I'm going to discard chlorhexidine, and I'm going to discard the gauze that I used, and I'm going to make sure that I let that dry fully and completely, okay? So we've used the aseptic technique by scrubbing with the friction back and forth with the chlorhexidine, both on the tubing and around and underneath the tubing, to make sure everything was clean. So 30 seconds of that, and then we let it completely dry. Now it's time, we can go ahead and put our bandage on. So I'm going to grab the bandage. Now this is a different bandage than what came in the first kit, because I had to. This is my second time doing this, so I had to do it that way. So now we're going to go ahead and this is a covering, so the bandage is not exposed yet. So I'm going to go ahead and expose the bandage. And now we're going to place this over the catheter. And then it's nice and clear, so you could just peel it off. So that's what I'm going to do on each side. Peel it off. Drop that down. And now everything is covered, and we can just secure it onto the catheter, and it sticks just like tape. You just got to make sure they put this protective kind of sealing in, and what it's for is to make sure that you're not touching the bandage, and that it remains clean, because it's going right over the patient's catheter where they would be exposed, and you don't want anything to be touching that. So now that we've got the new bandage on there and it's secure, everything's good, now I can go ahead and I can get rid of all of these other supplies. No longer in need of the sterile field anymore, so I can get rid of that. And I can go ahead and remove my sterile gloves. I'm going to perform hand hygiene. Just talk to my patient, let them know, hey, we got the new bandage on there, everything looks good, no signs of infection. So now that my hands are clean, I can go ahead and take my clean pen, and I want to go ahead and put this comes in, usually a label comes inside of the package of the bandage. So go ahead and put today's date, I'm gonna put the time, and I'm gonna go ahead and initial it with my initials. All right, and I can dispose of that pin. And then just right on the outside, so not the label won't actually touch any part where the patient can get infected. We just put it right on the outside so that the next nurse coming in knows, hey, my initials, the date and time, and they know that that has been recently changed, and they know when it'd be time to change it again, okay? So that is how you do a central line dressing change. Thank you.